started momentarily. And welcome to the webinar. All right, here we go. Hi everyone, and welcome to this webinar, which is part 2 of our webinar series on digital maturity in healthcare, a conversation with leaders and honorees of the 2022 DigiM Digital Maturity Awards. My name is Paddy Padmanabhan. I'm the founder CEO of Damo Consulting, and it is my great pleasure to invite our panelists for this webinar. We have Tarun Kapoor, Senior Vice President and Chief Digital Transformation Officer at Virtua Health, Sophie Liu, Senior Vice President and CIO of Northwell Health, Sophia Salim, Chief Medical Information Officer at Northwell Health Physician Partners, and Sarah Vaezi, EVP, Chief Strategy and Digital Officer at Providence. Welcome, everyone.
Thank you, Patty.
Thank you.
Thank you all. And so what I'd like to do is just provide, for the benefit of the audience, a little bit of an overview of what today's webinar is going to be about. We, for many of you who are familiar with our work, you'd be aware that we just concluded our DigiM Digital Maturity Momentum Awards, which was our inaugural awards program. The purpose of the program was to really recognize the healthcare organizations, health systems in particular, that were doing outstanding work in digital health and digital transformation. And as a part of our work with many of the health systems, we were assessing digital maturity using our digital maturity framework. And we thought that it would be interesting and beneficial to the industry as a whole if we could use the same framework to assess organizations on their digital maturity and recognize the leaders in the space. So we were very pleased to get a large number of submissions and nominations for the Maturity Awards. We had several categories for the Maturity Awards: overall leadership in digital transformation, and then a couple of individual categories for digital engagement maturity, more on the consumer side, and then the technology innovation maturity as well. We wanted to make sure that we recognize not just the large health systems, but also some of the smaller health systems who were doing remarkable things with limited resources. So with that, I'd like to actually share with the audience. I'm so pleased to share this slide and recognize all of the leaders on this slide. So we have Geisinger, Providence, and Northwell Health, who were ranked industry leaders. On the honor roll, we have Virtua, Intermountain, SCL. Intermountain and SCL submitted separately, but they're now one company, as most of you know. University of Rochester Medical Center, Sentara, and MediSys. And we have a couple of individual categories as well. And so I just wanted to take a minute to also explain the process. We use the digital maturity framework, which I'm going to cover very briefly. And then what we did was use the scoring model behind it, which is a standardized scoring model and an assessment tool to evaluate the submissions. We also had a panel of independent advisors, former CIOs and CDOs, who guided us and coached us on how to do this, and we wanted to do this right. And so we're very pleased with the outcome. So once again, congratulations to all the leaders and the honorees. And I couldn't be more pleased that we have some of the leaders and the honorees right here on this call. So let me open up this webinar with a question to participants and our esteemed panelists here. Besides the recognition itself, is there something you got out of being part of the awards program and the process? Just like to take a brief comment from each of you. So Tarun, can I invite you first?
Yeah, so hello everyone, Tarun Kapoor, TK for short. So, Virtua, as Patty mentioned, we're not the biggest fish in the proverbial digital ocean. We're about a $2 billion health system, around 13,000 employees. we stood up a digital transformation office about 22 months ago, and have been on a pretty rapid pace here, like so many others have on it. I think one of the most valuable things about going through the exercise was just, like many things, strategic, taking a step back, pausing, and say, okay, what have we done? How well have we done it? And then comparing ourselves, with folks who are the who's who in the industry, and saying, okay, where can we go? Where can we get better? And where are we actually, and where do we also deserve to give ourselves a little pat on the back as well, right? Acknowledging the work that we've done. So I think just having a frame of reference of understanding the work, because there is no lack of things to work on in this space, but are you working on the things that are giving you the greatest impact? And are your peers thinking about it the same way? So I think from that perspective, just validation of the things we need to work on, but it also tweaked our plans going through the exercise, tweaked our plans in 23 a little bit as well.
Thank you. Thank you. Anyone else?
I think, Patty, I would just jump on the same and also just add to it that the independent sort of categories or thoughts that poked whether or not we are really doing the right things, and also where are maybe some of the gaps that we may need to focus on from an outside perspective, in the details that it revealed in sort of the evaluation and questionnaire was very enlightening for us and important because in addition to working with these esteemed colleagues, it does give us a sort of lay of the land across large and small, and that it validates some of the things that we're focused on and some of the same things that we're all doing to raise the experience and the health across the nation. So thank you for doing this.
Thank you.
What I found interesting about the process as we went through it, and as Sophie just noted, having that outside perspective, how folks see the evolution of the space as these sort of almost from a capability oriented perspective as opposed to an experience oriented perspective was very informative for us, because we're on that journey as well. And in many cases, we think about it still from a capability lens and focus on developing those capabilities. But as I was kind of going through the process and thinking through it, I was like, we could spend all of our time on capabilities. Let's understand how, like, what experiences are essential that drive value, and then the capabilities that enable those experiences, and then deploy against those. And I know, Patty, you'll share some slides around sort of implementation versus importance versus performance. And ultimately, it kind of gets down to, what do you value? Are you putting your resources against the things that you value, and are you getting the expected results? And to me, like, in general, we're sort of heading in that direction, but we've got a long way to go. And that's going to be the sort of inflection point in digital that's going to drive a lot more adoption and much more sort of broad enablement as opposed to sort of piecemeal enablement. So that was, in sort of going through this process, but also reflecting on it after the fact. That was kind of the big, thing that I was thinking about from what we need to do to transform ourselves.
Thank you. Thank you. Any quick thoughts, Sophia, before we move on?
Yeah, no, I mean, building on what Sarah just said, I think that the, recognizing what we have done and grown in the different spaces, how do we really tie those together now, as opposed to continuing to build new things? And then seeing that, oh, well, we hadn't really thought about this, but many people are thinking about this. Is this something that we really need to focus on? Was really valuable. So, just adding on to what others have said.
Yeah, and I know you have a very unique role at Northwell, and we're going to come to that when we discuss one of the charts. So with that, why don't I just spend a minute for the benefit of the audience to just talk briefly through the 4-stage digital maturity model, which is the foundation and the basis on which we actually launch the awards program, and we assess the organizations as well. So very briefly, the 4-stage maturity model goes from model 1 through model 4 in terms of increasing maturity levels. Model 1 organizations are essentially those that look at their EHR platforms as the start and the end of their digital strategy. We believe that can be limiting, but for a variety of reasons, it works for a lot of organizations. But for true digital experiences that are best in class and that are comparable to the kind of experiences that consumers are now getting used to in other sectors, Model 2, Model 3, and Model 4 is really the progression. Model 2 organizations go beyond EHR to look at best-in-class tools for access-related capabilities for the most part, but also potentially for some virtual care as well, telehealth, and so on. Model 3 and Model 4 are the most progressive organizations. They tend to have a dedicated chief digital officer. They tend to have board-level approvals and sponsorship for the digital transformation programs. They tend to take a multi-year approach and an outlook. They have strategic partnerships with large enterprise-class technology firms, but also have a strong internal capability for harnessing startup digital health companies and other innovative companies in the ecosystem. And they typically have an advanced data and analytics program. So and we find that some of the larger organizations, and we'll talk about this later in today's webinar, tend to have a group of senior executives who are collectively driving digital across the organization. So for the audience, anyone who is interested in learning more or for downloading the report, you can actually scan this QR code or just go on our website and you can get a white paper on the model as well as the complete report on the Digital Maturity Awards. With that, let me jump into the charts, which I know everybody is waiting for. So there's a handful of charts that we're going to show. We actually collected a lot of data, and this is not just from the award submission, but these charts represent aggregated data from a large number of assessments that we've done over the last couple of years. And I'm going to start with this one, which is on patient engagement and what is the adoption level. I'll just make a high-level comment or two about this chart. The way you would read this chart is that from left to right, it is organized in terms of what is broadly implemented. So on the extreme left, you have real-time video visits that 95% of our respondents have implemented broadly, followed by patient portal, mobile app, and so on. The important thing to note here is that the bar in the middle represents how important a particular capability is to an organization. And the bar on the far right, which is the yellow one, represents how well that particular capability is meeting expectations for the organization. So with that, I'd like to open it up for comments. Sarah, why don't we start with you? What do you think? What do you make of this chart?
I think this kind of connects to my other comment, and we spend a lot of our time on this sort of domain within my team at Providence. This really is the sort of capability by capability view. And I think Sophia also commented on this, like, how do all of these things come together around how a patient, for instance, wants to access same day care or on-demand care, or how we want to do new customer acquisition and pull folks into an ecosystem, drive them online, or support them in getting online with us, and then create a engagement between episodes of care. Like those kinds of more horizontal things, I think, is where I'm excited about us building on these capabilities. I also find it very interesting that in some cases, like online scheduling, online check-in, the importance completely outweighs the actual adoption and performance. And to me, that spells that there's we often talk about this. Technologies, often these are not technology problems or challenges, right? That technology may be in place, but the operations or the change management or the workflows or what have you may not be supportive of the thing that we're trying to drive toward. And online scheduling is a really clear example of that, where there hasn't been as much sort bringing the clinicians along to ensure that we get that done in the right way. And so to me, this is almost less of a technology slide and more of a opportunities for operating models and experiences. That would be my key takeaway here. And I'll just give one more example, is that for online self-scheduling, we have significant challenges in our markets from an access perspective. We have, about 30-day wait times for new patients for primary care to get folks in. And some of that is driven by the fact that we simply are capacity constrained, but some of that is driven by the fact that, folks can't go online to find, like, they'll look on our provider directory and just click out, right, for months on end sometimes. And the reason for that is that we haven't, our providers are not consistently online. In some cases, they restrict the number of visits that they have available online. Our templates are not quite yet standardized, though we're getting on that down that front. So again, it's a really important dimension to the customer experience, achieving our business goals, and we just kind of haven't, we have the technology in place. Again, it's not a technology challenge, it's a broader business model and operating challenge that we're still going through. So those were some of the things that I, as we reflected on this, once we filled it out, those were some key takeaways.
I'll just add on there, what kind of jumped out onto me was the difference between tools and solutions on here. Like chatbot jumps out at me. It's like, okay, well, you got to check the list, got to get a chatbot going, but to solve what problem? Yeah, and one of the things I asked my team is, so hey, tell me about your experience the last time you used Amazon's chatbot on their webpage, and the answer is they don't have a chatbot on their webpage, because you don't need a chatbot if you can find what you're looking for right off the end, right? So are you using a tool because you didn't design something else correctly? But there are times I want to chat with somebody, and because I want to have a deeper conversation, because I'm trying to navigate something that's very thorny. One of the things, so we've implemented chatbot for MyChart. And one of the things we learned about MyChart is 5% of people who come to MyChart are using the chatbot, which is a fairly significant percentage in our mind. And it's because if you're looking for something in MyChart, like, I'm looking for my labs, but I don't know whether I look under labs, tests, results, right? So it's just understanding the problem and then creating a solution set versus just checking off the tool, because how you use the tool actually then gives you the return. And that's where that that yellow bar is high or low in so many different places.
It's interesting you mentioned chatbots, Tarun, because that's the only chart here that I see where the yellow bar is higher than the blue and the black one, implying that, first of all, does it surprise you that only 1/3 of our respondents seem to think chatbots are important, but those who have implemented it are getting good results out of it? Does it surprise you that the chatbots are relatively low in importance?
I mean, I'll just make a quick comment. No, it does, because sometimes it points out the deficiencies in our lack of human design. Right, that we design things that are convenient for us, but are not necessarily convenient for the consumer side of what the consumer is looking for. We know our world, right? We know exactly what corridor to go down and get the MRI machine, find the MRI. That is anything but how the consumer is thinking about it. So I think it challenges us to think of it, but I certainly would defer to my colleagues for their thoughts as well.
Sophie, I'd be very, very interested in your thoughts from a tech standpoint in particular, in addition to whatever leaps out at you from the chart. Also help us understand how, as a CIO, you make these trade-offs and the choices to enable these capabilities, and the EHR versus the digital health is one such trade-off that comes to mind. But I'd love to hear your thoughts.
So I'll start with a chatbot. I think whether it's a chatbot or a bot in itself, the performance mostly meets because it should be seamless and it should be sort of transparent to the user when it's successful, right? And from an engagement perspective, I think I would agree with everything Tarun said and what Sarah just said. A lot of the technology focus should be really about what problem we're trying to solve and what experience we're trying to bring. And it's not about that one specific function and feature, but how do they all tie together to journey whatever sort of destination or adventure that the patient or the family is traveling. And again, I'll just say technology should be enablement and not necessarily the solution ever, because it will fail if it is the solution only. And I can't emphasize more the importance of that, because in any of, I think this chart reveals, and in any of the investments that we've done in technology, the operational readiness and the feedback, the infinite loop that we want the feedback to optimize that experience, potentially by technology, potentially just by changing some of the flows of that design, is what will sort of meet the consumer, and evolve with the consumer. I think separately also, I want to emphasize, even though this says patient engagement, but I think Sarah mentioned it earlier too, part of that engagement, you have to have the opposite end to meet. So at Northwell, we say two sides of a coin. One side is the consumer or the families, and the other side is the clinicians and the operations that really meet that need. And how are we making it also simple? Everything we preach for the patient experience, we should be preaching for our clinicians and for our operations, right? It should be also frictionless for them. It should be easy for them to navigate. It should make their job easier to engage and interact. And I'll say one last thing about technology, that's my pet peeve, also is that in order for any of this technology to be useful, it also needs to be integrated, and it's not really sort of a UI UX with a checklist in the back for some human to sort of transact and navigate. We at Northwell took a lot of time, because we're constantly growing and evolving and acquiring. We have a very disparate best of breed, like 3,000 apps in the back end. So in order for us to make that seamless, a lot of time needs to be put in to integrate that to all the respective systems that it needs to interact with and reveal that data or reveal that experience. So it's important to take the time to do that and not only present sort of a face for that experience, both from a consumer and a clinician side. And secondarily is the importance of the data. So part of the maintenance and the availability of the quality of that data, whether it is the inventory of physicians or services or sites or insurance they take, that all of that is important to make sure that you're navigating the right way to enable all of these bars. And a lot of that stuff takes time, and it takes energy to maintain. In addition to the sexy tech.
Yeah. Now, I want to come back to the data question, but before that, I had a quick question on a comment that you made about this vast estate of applications that you have. Are you thinking about consolidating them? Are you going to let them be what they are? Can you share? I'm sure there are other CIOs in a similar situation where over the years you've accumulated a lot of applications. So what are your thoughts on that?
So we are constantly rationalizing and standardizing that, but of course, joining that along with the pace of growth, we will ever be in a state of adopting and evolving new inventory of systems as we grow. But yes, Patty, we are looking to see how we can rationalize and reduce our estate or our inventory, both on the system side. We're also looking at it from a modernizing the tech stack relative to looking at cloud, and also looking at the capability of what we want to say is a digital hub, because a lot of sort of the development and the digital sort of evolution of it, you need to be able to hook on and engage with the foundation. No matter how complex it is, we have to make that easy and not bottleneck that experience for our innovators and our team members, both from a digital front and also engaging sort of outside partners that we want to do. So those are some of the technology areas that we are very focused on in the upcoming years, and also sort of our core strategies around our digital multi-year investments.
Yeah, yeah. And Sophia, you have a focus on the provider landscape, and Sarah made a comment about this online scheduling, and
Yeah.
so this is your word. Talk to us a little
Knew
bit
we were
about
gonna-
that.
Yeah, no, I knew we were going to go here actually. I think that it's been a tough road for physicians. They're burnt out, and in some ways, promoting online scheduling to them feels a little bit like a loss of control over, the little bit that they might, still feel like they have. And so I think there is a cultural kind of battle to wage here a little bit, to understand how do we make sure that the physicians don't feel commoditized. They feel like we are recognizing their individual practice patterns, their individual skill sets, and what really makes them different and unique from one rheumatologist to another or one urologist to another. And making sure that they feel like their ability to show and demonstrate those skills that are unique to them come through, rather than just treating them as if they were scheduling resources, which is really how it's been over, and the perception has been, how do we just add the volume. And so I think by creating a conversation with physicians in that way to promote their individual styles, it will help them understand why online scheduling is going to only help their practice and not hurt them. And so those are the cultural battles that we need to start waging.
That is fascinating. And before we actually have a slide just for you coming up, Sophia, but before that, before we move off the slide, I do want to spend a minute on the data piece. And Sarah, I know you've done a significant amount of work around this consumer data platform. It seems to be a hot topic these days. Can you share a little bit on that?
Sure. I think we've talked a lot about connectivity across these things into solutions or experiences. And the problem that exists there, as we've talked about, is that there's fragmentation of the solution sets. There's fragmentation as a result of the experience for the patient or the consumer. And the first step to eliminating fragmentation around the experience is eliminating fragmentation around the data. And so what we've done is actually kind of two things: the consumer data platform, which I'll talk about in just a moment, as well as identity. And so the consumer data platform is, we're primarily using it for marketing type use cases, but we're bringing together data from clinical, financial, purchased data sources that are not our own, web data, so understanding behavioral data on our digital properties and knitting them all together so that we have a sort of whole person view of how someone is interacting with us, and what kinds of content they're interacting with, and then essentially using that to develop sort of propensity models around what might be the types of services that folks are looking for, so that we can proactively put those services in front of them to support them in getting the care that they need. So that's our consumer data platform. And it's not so much about building the sort of technical architecture for it, but more about knitting together the different data sources around a given individual. That also is connected to our identity platform. So we, I see single unified patient portal here. And in many cases, health systems equate the identity from a clinical perspective, and that is housed within the patient record with identity. And those are two different things from our perspective, right? Number one, there may be different instances of patient records based on if you have multiple instances of an EMR. There may be there's all sorts of kind of identity challenges associated with equating the EMR to identity to a patient identity or a consumer identity. So we've abstracted that out and pulled it into what we call a simple patient identity that sits outside of the EMR, and it's essentially it's a connection between an IAM solution and an Active Directory and the patient record within the clinical record, and it allows us to do identity resolution across multiple digital properties. Allows us to do verification, as well as federation of identity. So it's not just about us, it's about the individual and all of the different sort of components of the healthcare ecosystem that they interact with. And one of my colleagues at another health system actually used a phrase that I love that we have adopted as well. It's about engagement, not entrapment. And so those two things, the consumer data platform, which allows us to do targeted outreach, and this identity platform that allows us to really understand individuals and then build experiences on top of that, are two of the big things that we're doing in terms of data from a consumer perspective. And then of course, it doesn't just stop right at the identity or the data itself. It's about what those things enable, the experiences that they enable. And so that's where we've been focusing a lot of our efforts.
Thank you. That's, that is a whole topic in and of itself. So hopefully we can cover that in another. Moving on to this next slide. This one, I'm going to come back right to you, Sophia, and of course go to Tarun as well. You're the physicians in our panel today. Love to hear your thoughts on what you're seeing around provider enablement. I'll just make one quick comment. I find that the bars, all the bars here are shorter than the bars on the previous slide, which to me at a very high level suggests that either they're not that important, or they're not that broadly implemented, or they're not doing as well as patient engagement initiatives. I'd love to hear your thoughts. Let's start with you, Sophia.
Yeah, sure. I think that your data is telling about where the priorities of most health systems are. It's certainly around engagement of the consumer. And it's about access really for the consumers, the patients. But recognizing that our providers are, another class of consumers, you don't see the level of importance, you see on the patient side related to, networking, education, reference materials, and really providing the clinical team the tools to be able to deliver care virtually, virtual consults. And I think the referral management, we get a high bar here because, again, that's a little bit more about access for consumers, for patients. And so I think that you're, spot on in your assessment. And one of the things that our health system is focusing on through my role and many people who, I get to work with is that provider experience and what they really have to go through in order to deliver their care. And it's been an interesting journey. And actually, we borrowed a lot from the marketing side and the consumer side in their concepts of understanding the identity of patients. We're really growing in how we identify and understand our providers. I was mentioning earlier in an earlier comment about what do we know about our providers that makes them unique and different. And that is something we're really digging into here at Northwell, and leveraging that and using that too. And I'm going to really borrow some marketing terms to segment out our market on the provider side to say, well, we've got actually different pies and different slices of clinical teams and what they bring to the table, who they are, what they care about, and what they can do, and how they want to deliver care. We talk a lot about creating high reliable experiences for our patients. And, that can be done and quality care can be delivered in a consistent manner, but it doesn't have to be in the same way. I can be a provider that prefers to do this part of my clinical journey for my patient virtually, asynchronously, and that doesn't diminish the quality of care. And it may even actually make it better because it expedites that. So leveraging our providers' different skills and what they're interested in doing actually only deepens our bench and our skill set. And I think that patients will also respond to that because they're recognizing that they are also individuals that may not be on the same journey. A patient with prostate cancer over here may be very different than a patient with prostate cancer in the next town over, and they may want to receive their care differently with a different type of provider. So our first step in understanding, our providers and what they want has been to get to know them better and know their identity. And then we take a very product approach to say, what do our providers need? What are the products they need? What is the minimum amount of product that they need to get their job done? And how do we make sure we achieve the correct product market fit for that specific thing that we're trying to develop? So that's really been, what we're hoping to achieve in our strategy. And it speaks to a little bit about what you've got on your graph here and really bringing up the importance of what our clinical teams need.
Tarun?
Yeah, just, I totally concur with what Sophia is talking about here. And I think classically the two consumers we serve in digital transformation, right? The patient's consumer and then the clinician consumer. This historically has been a zero-sum game. So if it's going to be more convenient for the patient consumer, that means the physician consumer has to give up something, right? More clicks, and there are unique opportunities where if we can craft it as a win-win for both, right? This is where you get the viral adoption. You still have to do a lot of at the elbow slow change management, but we all take viral adoption whenever we can get it. And so looking for those opportunities, for example, digital rounding, we responded, we're not broadly implemented. We're not at the performance where we want to be, but we think there's a huge opportunity here. Very simple use case that, we started with is if you had a positive cath and you possibly need cardiothoracic surgery, we do our CT surgery all in one central hub. Well, why would you schlep a cardiothoracic surgeon halfway across, a different town to meet with the person? Vice versa. Why would you transport the person right away and only to meet their cardiothoracic surgeon a little bit later? We do a video introduction between the patient, family, and the cardiothoracic surgeon, ideally within less than an hour after they get their cath results back. That's a win-win for everyone. Right? It's a win for the patient and the family. It's a win for the cardiothoracic surgeon who's meeting the person. And that's a huge win, which didn't necessarily cost anyone. Trust me, I wish they were all this win-win, but they're not. But when you can find those wins, that builds trust. And usually the greatest impediment to change management or adoption is fear. And if you can trust as the counter to fear, that's how you get adoption in our world. And so, I think digital adoption is all about addressing fears and countering with trust.
I want to go back to that one very telling comment you made about this being a zero-sum game. And at Demo, we like to think that you cannot improve patient experience at the expense of the provider experience. You should not be doing that. I'm really fascinated by the comments that Sophia made that now you're taking a product approach. So in other words, your provider is also your consumer, in addition to your consumer being a consumer. That's kind of a very interesting perspective. So we're going to keep moving along. I want to jump to the next slide here, which is on care management. Sophie, let me come back to you on this. I'll start with a high-level observation because I've been looking at these charts for a while. I find that this chart too, or this group of charts too, is shorter than the patient engagement chart. And the one thing that struck me was that the middle bar is higher than the sidebar on almost all of these charts, indicating that even though these are all considered high importance to the organization, for some reason, they're either not broadly implemented nor are they meeting expectations. And I was really struck by the one in the middle, which is mental health. So, Sophie, let me start with you. What do you make of this?
I think if I take it really from a patient's perspective, what I make of this is I think we have very individual solutions across the continuum of care. How do we connect those solutions and or target that for the specific use case that the patient journey that they're going through? And so I think there is definitely a significant gap in care coordination within the health system, and also how do we communicate and help the patient and their families to say, who's your quarterback at this time? Sort of going at bat for you across the continuum. And then, is there a technology or a solution that enables that? I think there is a gap there. And I think that, there's a lot to be done in maturing the individual products and then thinking about them bigger than that solution alone, and connecting whatever those departments that is servicing that patient be, to be transparent and to have a way of interacting with them, with the clinicians and with the administration process in a way that is, I'll go to the omni-channel way, I'll go to the easy way on how you want to engage. It is very difficult, and the more complex the case for patients to navigate and to find out what is going on behind the scenes with the care team, and then what is the next step and where are they in that list of anything, whether you're going for surgery, whether you're waiting for an appointment. We're still maturing that journey.
Yeah. Sarah, you're also a very large health system, one of the largest in the country. What do you make of this?
So a couple things, and Sophie just alluded to one of them. This is, I think this does again spell the or point to the problem of just these individual solutions, and where do they live? How do they kind of ladder up into a consumer-facing tech stack with a set of provider tools on the back end that are interconnected, and drive towards some specific outcomes and some specific experiences that you have a kind of an orientation around, like, what are you trying to accomplish? I'll give you one example that we had at Providence that we learned a lot from in the mental and behavioral health space. You called that one out, Patty. A couple of years ago, we were testing a computerized cognitive behavioral therapy solution, and determining whether we were going to deploy it broadly across the organization, kind of as an extension of our the care that our primary care providers could provide, but they don't have the time, they don't have like all of the resources. We're significantly capacity constrained on the behavioral health side of things anyway, and so we tested this thing out, and ultimately we came to the conclusion that it's computerized cognitive behavioral therapy is kind of a commodity, right? Like CCBT, it's not that there are tech-enabled services that are differentiated, but the CCBT itself is not necessarily something that is earth-shatteringly different from one solution to another. Fundamentally, but we saw a drop in how our users were engaging with it. And so we realized it's fundamentally an engagement problem. And if you're not putting it into a place where it's easy for folks to engage, where you're wrapping around other services, that service is going to not, that product is not going to be utilized. And if you don't use it, you don't get the benefit, right? So that's one, like, how do these things, again, wrap together into one kind of place that's a meaningful solution that's driven off of identity of a given user, and that it's wrapped up again into something that is more kind of coherent from the patient's perspective and has provider-facing tools that they can engage with to understand sort of the insights on the back end. Yeah. The second thing is you get what you pay for, and we don't pay for basically any of these things, right? So we don't really, I mean, we kind of pay for hospital at home. There are emerging models around it, but I don't think that they've sort of caught up with like the legacy systems where the dollars are. We don't really pay for chronic disease management. We're fundamentally dealing with like transition economics problems where we're trying to make it into the new world, tech enable it, and we're still paying for things in the old world for the most part, or it's too much of a mixed model to really make that transition meaningfully. So I think that's what I take away from this is, it's important, but we haven't kind of put our money where our mouth is, and we don't have the underlying infrastructure to enable it.
Oh, it's very interesting, the last comment you made, because one of the panelists from the first webinar we did on this called this out as a perfect reflection of the reimbursement framework in the healthcare economy today. So 90% or whatever the number is, a very large percentage of reimbursement is still in the fee-for-service model. And this chart is a reflection of that. It is exactly what I thought I heard you say, Sarah. But turning to the physicians on our panel, Sophia and Tarun, if you want to take a shot at it, how do you relate this to the previous chart that we saw, or is there a relationship at all? Sophia, why don't we go with you first?
Yeah, I was going to say, I think that, Sarah and Sophie's point about these being really growing point solutions for each one of these just continues to disarticulate, the experience for the consumer. And so you won't get that engagement because it's not wrapped up into, what Sarah was just talking about, delivering that solution to them when they need it for those who need it in a consistent, cohesive way. That same process is happening on the provider side, where a provider may hear about, there's this new app or tool for patients who have, mental health issues, but how do they remember that in their day-to-day? How do they incorporate that and integrate that into their workflow so that it becomes a reliable resource for them, and it becomes meaningful to the patient because their physician told them about it and told them to expect this. Those are things that I feel like we need to mature, and that's what when we talk about, how are we going to engage our clinicians in digital transformation, this is exactly that. We may not get to a place where we have a full stack of solutions that's beautifully coordinated right away. How do we train our physicians and our clinical teams to say, well, right now we have this tool. So if you were to order a behavioral health referral, for example, you're going to get these services and your patient's going to get these services. How do we explain that to the provider, not as a one-off for every single point solution and that they would have to synthesize? So those are the things that we're facing right now. And I think training, as unsexy and boring as that is going to be critical to us getting through any kind of digital transformation, and not training to the application or training to the program, but training to the workflow, training to the job that's got to be done and how to do it. And so those are things that, I think on the clinician side of it, we're going to have to focus on so that they can create meaningful experiences between the patient and these solutions.
Just everything was been said so far is great. I would say that the only thing I would say is different, is like a little bit add on to, is that the training is not just for the clinicians to think differently, it's for the entire organization to think differently. That, the mindset in healthcare is research it ad nauseum, try to perfect it as best as you can. This is the, your classic Six Sigma approach, and then, implement. And the reality of it is, and for those in the software world, right, they would just abhor the concept of this. Is, there's a diagram. My team is so sick and tired of me putting in front of them. Is Henrik Nyberg's skateboard to convertible diagram. From the Spotify world. We all have to get very comfortable with, we're going to give you a skateboard. I know you asked for a car, but let's give you a skateboard and try it for a few weeks and tell us what you learn. And you're going to get people looking at you differently, but eventually we will get to a convertible, if you even needed a convertible, because you might find out halfway, it's like, I never even wanted this. And so instead of designing something for 8 months or 12 months at a time, how do we start learning to work in 4 to 6 week increments of making progress? So that, that's the curse of the bleeding edge, cutting edge. If you're going to have to throw away stuff, and that is not comfortable for people. The risk of it is, well, if I don't want to be that, and I want someone else to perfect it, and then I'll just come in later, no problem, but it may be too late to the game. And so this is this balancing act of bleeding is never good because you're just going to literally bleed. Cutting is probably good, but you don't want to be late either. And I don't think any of us on this call have figured out we've made bleeding edge problems and we've waited too long on some other things. So it is a constant evolution.
Right.
I would also, Tarun, I might also add on to that, completely agree. And I'll add on to that to say, with the training and or the reimagining, it's not literally taking today's flow and today's experience and making that digital. And I know it's probably been said, and I'm preaching to the choir, but we do it a lot. Look at digital forms. The forms are not necessarily, I would think the best experience. It's sort of, kind of same old, different look and feel, but is there a way to reimagine some of that in this evolution?
Yeah. Well, we're coming up to the final moments of our webinar here, and this is a chart. This is the final chart that we're going to show here on industry benchmarks, org model. Just a couple of high-level comments I want to make, and then I have a question for the panel. Now, firstly, you can see here that our 2/3 of our respondents have a dedicated digital function. Now, if you're the half empty type, you might think, well, what is the other 1/3 waiting for? And similarly, the reporting relationships and when did they actually start the digital function? It looks like, at least going by our survey data and our sample sets, but half the respondents started their digital function only 2 years ago or less than that. So which means the pandemic may have been a forcing function. And now, of course, 2/3 of the organization seem to have a roadmap. Now, we're in Q4 of 2021. We're coming up to 2023 now. I imagine that, like many other organizations, you're also in your budget cycle and so on. So let me throw open this question for the entire panel. I'll start with you, Sophie. What does next year look like in terms of your priorities and your challenges?
I would look at I thought of a funny as you pointed this out. What we try to emphasize in our organization through this digital transformation is that transformation is a mindset and a culture, and not necessarily with a start and stop. It's infinite. And if you look at sort of the journey, probably we went from manual to IT, from IT to IS, from IS to digital. And so where we're going in 23 is on the 3 areas that I mentioned earlier, right? We want to modernize our tech stack to enable the digital transformation capabilities to be easier and to be sort of enabled without necessarily bottleneck and tethered by all the foundational things that have to happen from your business as usual to take care of a health system our size. We are also looking at how to simplify and rationalize our technology footprint so that we can really, sort of clean our house a little bit to make it just as efficient for the technology folks as it is for the transformation in the organization. And where we are also investing is, doubling down on the transformation and investing in the talent and focusing on which areas we would want to invest to leverage that technology to enable the transformation and the impact to our constituents, whether that is consumer or operations or clinicians across the board. There's a lot happening in our bucket for next year. So we would really have to be very coordinated in what we are prioritizing and investing in as our foundation is shifting and evolving. And so that is where we're going and looking to differentiate ourselves all along the way. And not necessarily finding, again, all the sexy stuff that differentiates digital, but the interstitial and those difficult things that we talked about all throughout this hour. And is there some things we can do that may not involve technology and maybe sort of thinking about adoption and operational change and culture that we can instill so that we can leap into the journey because it's going to be multi-year.
Sarah, could you touch a little bit on what the macro environment has been like this year to Providence? You know, inflation, interest rate, labor shortage, all of that. Do you see any of that changing for the better? What does next year look like for you?
It's been a very difficult year. I think our CEO had said back in 2020, when the pandemic started, that 2020 was going to be a tough year. He thought 2021 was going to be even more difficult, and that 2022 was going to be as hard as we've ever experienced. And he was right. So 2022 has been sort of the point at which we're seeing the cumulative impacts of the pandemic, the challenge, like the kind of restructuring of the care environment in terms of, for instance, post-acute capacity going way down, that having impact on hospital capacity. Inflation costs have gone up. Inflation has caused our costs to go up a lot. In our markets, we're having a lot of workforce challenges, much like other places, but we also happen to be in a lot of areas with strong labor and organized labor. And so that just puts more cost pressure on us in general. And so, we're dealing with a lot of issues that we've perhaps dealt with singularly in the past, but all at once. And so, from a digital perspective, what that means for us is we've gotten super focused on what we believe is the core value proposition of digital, which is to generate demand and capture demand in sort of tech-enabled ways in a much more efficient way that allows us to drive profitable growth at lower per unit cost for the system. So that's what we're working on. And we're doing that through, again, really data-driven, targeted ways of new customer acquisition, a lot of work around scaling our patient retention efforts, leveraging our data platforms, our engagement platforms, our identity platform, and then using that to tap into new business models, new revenue streams that we don't think that the macro environment is going to get any better in 2023. It's going to keep getting worse, and perhaps forever into the future, right? From a care delivery perspective. And so it's really important that we start to meaningfully tap into other forms of revenue in order to support and sustain our business so that we can continue to support our communities into the future. So that's what we're working on from a digital perspective. And that's kind of the plan going forward for the time being. Awesome.
Well, Tarun, I'm going to have you let you have the last word on this, but before that, just a quick message to all of those who are tuning in today for the webinar. Please stay on to take the survey at the end. We're going to ask you what you thought of the webinar and what we can do to improve it and make it better. Tarun, back to you. Final question of the day: are budgets going to go up, down, or stay the same?
Globally across organizations, budget, I mean, I think Sarah and the rest of the team summed it up. We're seeing sizable revenue cost increases that are not going to be matched. They are not going to be matched by revenue, at least on a per unit. So it's either you got to take that business from somebody else or generate business that wasn't there before. And so there are going to be opportunities to do that. I would say that, so yeah, if anyone is saying across the board their expenses are going down in 2023 as an integrated delivery network, that means you're probably, because you're not in business, is probably what I would say, is that's the only way you're not going to have your expenses go up. The counter to that, I would think is, and it's the mantra we use here, is cold-blooded execution. At the end of the day, all these different health systems on here, we fundamentally have similar strategies. Right? I don't think there's all that dramatic difference. What's going to differentiate the people who get through this over the next couple of years is simply those who execute and focus. And I was very fortunate to be part of a startup when I came out of training, and one of my mentors in there taught me a lesson that no one ever went out of business because they focused too much. You may not be the biggest, and I think that's a lesson that's applicable to that's a lesson that's applicable to integrated delivery networks, but also to, for those who are vendors or technology companies here. Yeah, it may not sound the coolest thing in the world, and you're not doing tons of things. You're not on the covers of a bunch of different magazines, at least for the next couple of years. But you're going to be pertinent, and you're going to be viable, and you're going to be you're going to be around for the next go round. So yeah, execution, focus, and tough year ahead.
Thank you. Thank you. Thank you. Thank you to all our panelists for such a fantastic discussion. I'm afraid we're going to have to leave it there for today. There's so much we were able to cover, and so much more we could have covered, maybe back again for another session. So for those in the audience, thank you for tuning in. And if you want to learn more about Damo, if you want to download some of the reports we referred to and the maturity assessment, and if any of you is interested in doing maturity assessment, reach out to us and we'd be happy to oblige. Once again, Sophia, Sophie, Tarun, and Sarah, thank you so much for joining. Have a wonderful day.
Thank you.
Thank you all.
Have a great day.